there's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for health checkups, thinking they're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually push you closer to surgery, stroke, or even cancer? New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of people over 70 have no idea they're being over. One of these checkups, the number one on our list, actually causes 5% of all cancer cases in the US, which is equal to the number of cases caused by drinking alcohol every day. You won't hear this from your clinic. You won't see it on a billboard. But the truth is buried in the science. And today, we're uncovering it all. In T's video, the 5 health checkups you should avoid after 70. And the terrifying truth about what they can do to your body. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure? Do you think seniors are tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's talk about the first test. If you're a senior over 70, chances are you've either had a DEXA scan or your doctor has recommended one. These scans are often presented as a routine part of aging, as common as checking your blood pressure. But what if this seemingly harmless test is doing more than just checking your bones? What if it's quietly nudging you into a medical spiral you didn't ask for? Let's unpack this together with warmth, honesty, and a clear look at what this test really means for your health and peace of mind. What is a DEXA scan? A DEXA scan uses low-level X-rays to measure your bone mineral density. The idea is simple. The lower your BMD, the higher your risk of fractures. So, the test looks at your hips, spine, or wrist and compares your results to those of a healthy. If your bones look thinner, you may be diagnosed with mild bone loss or severe bone loss. Seems straightforward until it's not. Here's where it gets concerning. If your scan shows even a slight drop in density, you may be prescribed powerful medications. Drugs like Fosamax, Boniva, Reclask, or Prolia. They're intended to build back bone or stop bone loss, but many seniors report side effects like jawbone deterioration, severe joint, muscle, or bone pain, digestive issues, fatigue, and anxiety. And here's the twist. You may never have broken a bone in your life. You may be strong, active, and balanced, yet one number from a scan could label you as fragile, leading 2 years of medications and follow-up scans. But the DEXA scan does just that. Compares your bones to those of someone decades younger. This can create a false sense of urgency and fear, pushing you to treat a number rather than a real risk. Studies show that fracture risk depends more on whether you fall, your muscle strength, and your overall health, not just your bone density. So why does the medical system push DEXA scans so hard? One reason is prevention. Doctors want to catch weak bones early, but another reason is that it's become routine. Even when there's little evidence that treatment helps people over 70 avoid fractures. If you haven't had one before, focus on strength, not just density. Instead of fixating on the scan, focus on what actually keeps bones strong and unbreakable. Regular weight-bearing exercise, adequate calcium and magnesium from whole foods, not just supplements. Sunshine or a supplement to maintain healthy vitamin D levels. Balance training to reduce fall risk. These lifestyle steps not only strengthen your bones, but also improve your heart, muscles, and even memory. No prescription required. A personal choice, not a mandatory test. If your doctor recommends a DEXA scan, it's okay to pause and ask, what would we do differently based on the result? Do I have other risk factors like a history of falls or fractures? Are there safer ways to build bone without medication? You have every right to ask for alternatives or a second opinion. Medicine should support your wellness, not create fear. Here's a secret most seniors don't hear enough. You are not fragile. Yes, aging changes our body, but strong bones are still possible without a medical label. Take simple steps every day. Enjoy leafy greens, nuts, and dairy. Walk around your garden, your neighborhood, or even your living room. Use your muscles gently but regularly. Practice standing on one leg to build balance and bone strength. Now let's move on to the second health checkup. Let's face it, memory loss is one of the most frightening concerns for anyone over 60. That fear leads many people straight to the neurologist's office. And what happens next? They're sent for a brain MRI, a powerful imaging tool that sounds like it will give you answers. But here's what we're not told. Misters rarely provide those answers, especially when memory loss is mild or new. In fact, they can stir up more fear, more confusion, and more unnecessary procedures. What is a brain MRI? A magnetic resonance imaging scan uses magnetic fields and radio waves to take highly detailed pictures of your brain. It's used to rule out tumors, strokes, bleeds, or severe abnormalities like hydrocephalus. But if your doctor is using it just because you're forgetting words or names, it might be the wrong tool for the job. Here's the uncomfortable truth. Most age-related memory issues do not show up clearly on an MRI. What shows up instead? Vague phrases like mild cerebral atrophy, white matter changes, non-specific findings. These sound scary, but they're often just signs of aging. No more worrying than gray hair or wrinkles. Unfortunately, once seen on a scan, they can lead to a flood of worry. Further tests, or even medication trials that offer no benefit. Just because something appears on an MRI doesn't mean it's causing your memory issues. Most people believe that an MRI can diagnose Alzheimer's disease or dementia, but that's not entirely true. Alzheimer's is a clinical diagnosis based on or symptoms, cognitive testing, functional changes in daily life, exclusion of other causes. An MRI might support a diagnosis, but it's not definitive. Many people with normal MRAs have memory loss, and many people with abnormal MRIs function perfectly fine. In studies, routine MRIs for seniors with mild memory loss changed the treatment plan in only 5 to 10% of cases. That's right, 90% of the time. The scan adds little more than anxiety. Let's say your scan finds something uncertain. Maybe a white spot, a shadow, a little shrinkage. What happens next? Suddenly, you're in a medical loop. More scans, neurology appointments, memory pills, emotional distress, insurance costs, waiting, worrying, wondering. Instead of putting all our hope into a scan, let's talk about what really helps your memory end. It's simpler than you think. Here are some powerful, science-backed memory protectors. Physical activity, Evan Walken 30 minutes a day, improves brain blood flow. Sleep. Deep, restful sleep clears brain toxins that contribute to memory loss. Social connection, chatting with friends, activates memory centers. Mental stimulation, reading, puzzles, or learning new skills builds brain resilience. Nutrition, omega-3 fats, leafy greens, berries, and turmeric can slow decline. Stress reduction, meditation and nature walks reduce cortisol, the memory-stealing hormone. All of this is proven, and none of it requires lying still in a noisy machine, waiting for a verdict. Before you agree to a brain MRI for memory loss, ask your doctor. What are we hoping to find? If we find something, what would the next step be? Is this test more for reassurance, or will it actually change my treatment? Could we try lifestyle changes first and monitor? These questions help shift the focus from fear to empowerment, and that's where real healing begins. Not all forgetfulness is dangerous. In fact, most seniors experience benign forgetfulness caused by stress, fatigue, medication, side effects, or even poor hydration. So, before we leap to the worst-case scenario, let's take a moment to breathe. Here are 3 signs. Your memory issues may not be dementia. You'll remember things later. You can still manage your daily activities. You're aware of your forgetfulness. But if you're simply forgetting a name here and there, consider starting with a cognitive screening test. Lifestyle improvements. More sleep, more laughter, less pressure, and above all, don't panic. You are not broken. You are changing, adapting, and growing just like you always have. Now let's move on to the third health checkup. Imagine this. You're 72, generally healthy. Maybe you feel a bit winded after climbing stairs or walking a long distance. Nothing alarming. But at your next doctor's visit, they say, just to be safe, let's schedule a cardiac stress test. It sounds like the responsible thing to do. After all, your heart is the engine of your body. And if there's even a slight chance something's wrong, you want to catch it early. Right. But what if this test, the very thing meant to keep you safe, actually causing you more harm than good? Let's talk honestly and compassionately about the real risks of unnecessary cardiac stress tests, especially after age 70. What is a cardiac stress test? A cardiac stress test measures how well your heart performs under physical pressure. Most commonly, you're asked to walk on a treadmill or receive a chemical injection that mimics the effect of exercise. While you're doing this, a monitor checks your heart rate, rhythm, and blood flow. The idea is to uncover signs of blocked arteries, irregular rhythms, or poor oxygen flow. If the test detects anything suspicious, the next steps might include a coronary angiogram, a CT scan, a stent placement, even heart surgery. But here's what most seniors don't realize. If you're not having chest pain, shortness of breath, or dizziness, research shows that stress tests are not helpful in predicting future heart attacks. In fact, they often detect minor abnormalities that would never have caused a problem, and wouldn't have even been noticed if you hadn't taken the test. This is where things get dangerous. A mild abnormality can lead to invasive testing, and invasive testing in older adults can lead to bleeding, infection, stroke, kidney injury from contrast, dyes, false alarms that increase anxiety, and overtreatment. In a major 2017 study, over 60% of stent procedures performed in seniors after abnormal stress tests showed no significant benefit for long-term health or survival. Let's say your stress test is abnormal, even slightly. You may be told to go for coronary angiography. A tube is inserted into your artery to take pictures of your heart. Stent placement. A metal tube is inserted to open a minor blockage. Heart medications. Even if you feel fine, you're now labeled as a heart patient. Each step brings side effects, risks, and a growing feeling that something's wrong with you, when maybe there never was. This is what doctors now call the diagnostic cascade. It starts with a well-meaning test and ends with months of procedures, appointments, and fear. Before agreeing to a stress test, pause and ask yourself, do I experience chest pain when walking or climbing stairs? Do I feel lightheaded or faint during normal activities? Do I get short of breath more than usual? If the answer is no to all three, your heart may be aging. Naturally, not dangerously. What feels like mild fatigue could be caused by dehydration, anemia, stress, poor sleep, or medication side effects, not blocked arteries. Here's what's more powerful than any test when it comes to heart health. A Mediterranean-style diet, full of leafy greens, olive oil, nuts, and fish. 30 minutes of movement a day. Sleep hygiene. Good sleep helps regulate blood pressure and reduce heart strain. Managing stress, meditation, hobbies, time in nature. You don't need a test to take care of your heart. You need daily care, gentle consistency, and joyful movement. Ask your doctor these 5 questions before a stress test. To make sure you're not falling into unnecessary testing, ask, why do I need this test now? What symptoms am I showing that justify it? What risks come with the test, and what are the possible outcomes? If the test is abnormal, what will we do next? Can we try lifestyle changes first and monitor how I feel over time? These questions shift the conversation from fear-based decisions to informed, empowered choices. You are not alone. Thousands of seniors have experienced unnecessary procedures that stemmed from a single test they didn't truly need. Listen to your body, not just the machines. If you're symptom-free, active, and feeling generally well, there's a good chance you don't need a stress test, especially not just because of your age. Testing should be based on how you feel, not your birth year. If you have heart symptoms, Absolutely get evaluated. But even then, start with a conversation, not a treadmill. After learning about the hidden risks of some common medical tests after 70, you might wonder, so, should I avoid all tests? Absolutely not. The truth is, medical testing can be a powerful tool when used wisely and carefully. It's not about fear or avoidance, it's about making informed choices that honor your health, your lifestyle, and your peace of mind. Certain situations call for testing because the benefits clearly outweigh the risks. Here are a few examples. Sudden or severe symptoms. Chest pain, sudden weakness, severe headaches, confusion, or fainting spells deserve immediate evaluation. Monitoring known health conditions. If you have diabetes, heart disease, or cancer, tests help track your health and adjust treatments. Screening with proven benefit. Some screenings, like colonoscopy after 70 or blood pressure checks, can catch problems early. Pre-surgical evaluation. Before major surgery, tests ensure you can safely handle the procedure. How to decide which tests are right for you. Your best health advocate is you. When your doctor recommends a test, pause and ask, why do I need this test? Is it to find out something that will change what we do? What are the risks of this test? Could it lead to side effects, complications, or unnecessary worry? Are there alternatives? Could lifestyle changes, observation, or less invasive options work first? How will the results affect my treatment or quality of life? Asking these questions helps you avoid the health time bomb of unnecessary testing. Trust your experience and intuition. You know your body better than anyone. If a test feels unnecessary or stressful, speak up. It's okay to ask for a second opinion. Take time to research. Discuss known invasive alternatives. Prioritize comfort and quality of life. Doctors want to help you, but they also follow guidelines and protocols that may not fit every person perfectly. By becoming an informed partner in your care, you guide your doctor to make decisions that truly match your needs. Medical tests aren't the enemy, they're tools. And like any tool, their power depends on how and when we use them. With curiosity, courage, and compassion for yourself, you can choose tests that support your health without turning it into a worry-filled roller coaster.